The COVID-19 pandemic has resulted in the worst worker safety crisis in OSHA's 50-year history. Nothing compares. In the past 4 months, more than 62,000 healthcare workers who we've asked to risk their lives without protective equipment have been diagnosed with COVID-19, and at least 291 have died. And this is an underestimate. We cannot lose sight of the fact that this is largely a tragedy inflicted on our nation's essential workers, people who don't have a choice on whether they have to go to work, people who don't have a choice on whether or many of those are on the frontliners. They're low-income workers and disproportionately people of color. Yet OSHA, the agency that this nation has tasked to protect workers, have been largely invisible. It's failed to develop the necessary tools that it needs to combat this pandemic, and it has failed to fully use the tools that it has, instead focusing principally on issuing press releases and voluntary guidance. The only logical conclusion I can draw is that OSHA's inadequate response to this pandemic has been informed more by politics rather than modern science. The necessity to protect workers should not be cramped by state ideological notions about regulation, nor campaign slogans about repealing 2 regulations for every new one that's created.
What has OSHA done with COVID-19? Just like the Obama administration, it has issued detailed guidelines, placed an enforcement emphasis on high-risk workplaces, used an occupational risk pyramid categorizing workers' risks, and reminded employers of OSHA's existing standards on PPE, respirators, sanitation, and others, as well as their obligations under the OSHA Act's General Duty Clause to provide employers with a safe and healthy workplace. A standard at this point would be an unproductive burden for businesses already struggling to reopen, potentially exposing them to unnecessary liability risks during an already challenging time, and would do little to advance workplace safety.
As states are beginning to reopen their economies, OSHA is acting to ensure employers are protecting their employees. First, OSHA is increasing in-person inspections at all types of workplaces. Second, OSHA is clarifying its previous enforcement policy for recording cases of coronavirus.